Have you ever noticed small changes in your body that didn't seem serious at first, but deep down, something just felt off? Maybe it's fatigue that doesn't go away, or a little pain that keeps returning even after rest. Hi everyone, and welcome back to our channel. I'm glad you're here, because today we're talking about something truly important. 6 silent signs your body might be giving you that you should never ignore. Sometimes our body whispers before it starts to scream, and understanding these whispers early can save you years of discomfort, or even your life. Before we begin, make sure you hit that subscribe button if you care about your health and want more doctor-guided advice every week. Now, let's dive right in. Sign number 1, constant fatigue that doesn't go away. We all get tired sometimes, but when you're constantly exhausted, even after a full night's sleep, your body is trying to tell you something deeper. This kind of fatigue isn't the same as being sleepy after a long day. It's a persistent lack of energy, the type that makes climbing stairs, concentrating at work, or even doing daily chores feel unusually hard. Possible reasons? Your fatigue could stem from thyroid imbalance, anemia, diabetes, or even heart issues, but many people just dismiss it as stress or aging. Let me give you a quick example. A patient once told me she'd been feeling drained for months. She blamed her job and ignored it. When we finally did some simple blood tests, we discovered her iron levels were dangerously low, a condition that could have easily been corrected months earlier. So, if you're feeling tired for more than 2 weeks without a clear reason, listen to your body. Try this. Keep a simple energy journal. Note down your sleep, meals, and activity level for a week. Patterns often reveal what's wrong, and remember, chronic fatigue is never normal. It's your body's SOS signal. If this first sign sounds familiar, comment number 1 below. You might inspire someone else to take their fatigue seriously too. Sign number 2, shortness of breath. During mild activity, have you ever felt winded just walking up a few stairs, or even during a light conversation? If you find yourself catching your breath more than usual, it's time to pay attention. Shortness of breath, or what doctors call dyspnea, can signal heart or lung problems. Your heart might not be pumping efficiently, or your lungs might not be exchanging oxygen properly. A common mistake I see people make is assuming it's just getting older. But let me tell you, age doesn't cause breathlessness. Disease does. Sometimes this symptom is related to something as manageable as low fitness levels or anxiety, but it can also mean something more serious, like heart failure, COPD, or pulmonary hypertension. If you notice this sign, don't panic, but don't ignore it either. Start by noting when it happens. After climbing stairs? After eating? When lying flat? Those clues help doctors narrow down the cause quickly. And here's an easy tip. If you can't finish a short sentence without gasping for air, it's time to get checked. You might be surprised how early treatment can make a difference. I've seen patients recover strength and stamina just by catching this symptom early. Still watching? Comment number 2 below and tell me if you've ever noticed this happening. You might encourage someone else to listen to their own body today. Sign number 3, unexplained weight loss or weight gain. Weight changes can happen for many reasons: diet, exercise, or stress. But when your weight shifts drastically without you trying, it's time to take notice. If you're losing or gaining more than 5% of your body weight within a few months without a clear reason, your body might be signaling a hidden issue. Let's start with unexplained. Weight loss. It can be linked to several conditions, such as hyperthyroidism, diabetes, digestive disorders, or even certain cancers. In fact, I once had a patient who dropped 15 pounds in just 2 months without changing his routine. He thought it was a good thing, until tests revealed early-stage stomach ulcers that were affecting nutrient absorption. On the other hand, unexpected weight gain can point toward thyroid problems, hormonal imbalances, heart disease, or fluid retention. A practical tip: pay attention to where your weight is changing. Around the abdomen, could be insulin resistance. Around the ankles or feet, possibly water retention due to heart or kidney issues. Here's the golden rule. If your weight changes noticeably and you haven't changed your eating or exercise habits, don't just shrug it off. Your body is trying to tell you that something inside isn't balanced. If you've ever experienced this kind of unexplained weight change, comment *3 below. It might help someone else who's been ignoring the same sign. Sign number 4, persistent digestive problems. We all deal with an upset stomach or bloating sometimes. But if it becomes frequent, your gut might be raising a red flag. Common issues like bloating, constipation, diarrhea, or heartburn can sometimes signal serious underlying conditions like ulcers, IBS, irritable bowel syndrome, gallbladder issues, or even food intolerances. Your digestive system is like your body's internal alarm. It often reacts first when something's off. For example, chronic bloating might point toward lactose intolerance or gluten sensitivity, while persistent constipation might mean your diet is low in fiber or your thyroid is underactive. Here's a real-world example. One of my patients, a middle-aged man, used to pop antacids daily for heartburn. When he finally got tested, we discovered early esophageal inflammation, a condition that can worsen into something much more serious if left untreated. So if your gut is acting up for weeks or months, don't normalize it. Try keeping a food and symptom diary. Write down what you eat and how you feel after meals. You'll be amazed how often certain foods or habits show up before discomfort. And remember, your gut is the foundation of your health. If it's unhappy, chances are the rest of your body isn't doing great either. Still watching? Drop a 4 in the comments if you've ever struggled with digestive issues. You're definitely not alone. Millions do. And awareness helps. Sign number 5, frequent dizziness or lightheadedness. Have you ever stood up quickly and suddenly felt like the room was spinning? That can happen to anyone once in a while. But when dizziness or lightheadedness becomes frequent, it's a symptom worth taking seriously. This could point to low blood pressure, dehydration, inner ear problems, or even heart rhythm issues. And here's the thing, many people brush it off, thinking it's just fatigue or hunger. But let me tell you, as a doctor, repeated dizziness isn't normal. Your brain needs a steady supply of oxygen and nutrients from your blood. If something interrupts that flow, even for a few seconds, your body will warn you through. Dizziness. I remember one patient who came in after nearly fainting at work. He thought it was just stress, but a simple test showed he had an irregular heartbeat causing brief drops in blood flow to the brain. Once treated, his dizziness disappeared, and so did the risk of a serious cardiac event. Here's a quick self-check tip. Next time you feel dizzy, sit down immediately, take slow breaths, and drink some water. But if it keeps happening, especially with chest discomfort, vision changes, or confusion, see a doctor right away. If you've ever felt lightheaded often, comment *5 below. You never know. Your story might help someone realize they need to take that next step for their health. Sign number 6, swelling in your legs, feet, or ankles. Swelling might seem harmless, especially after standing all day, but it's one of the most overlooked warning signs in medicine. When your legs, feet, or ankles swell, it means fluid is building up in your tissues. This is called edema, and while it can sometimes come from minor causes like hot weather or too much salt, it can also signal heart, liver, or kidney problems. Your heart acts like a pump. When it weakens, fluid doesn't circulate properly and starts pooling in the lower parts of your body. That's why swollen ankles are often an early warning sign of heart failure. Here's what to watch for. If the swelling is worse in the evening and improves after a night's rest, if pressing, your finger leaves a dent that stays for a few seconds, or if it's accompanied by shortness of breath or fatigue. Those are red flags that something deeper might be wrong. A simple lifestyle tip: try reducing salt intake. Elevate your legs for 15-20 minutes a few times a day, and wear comfortable shoes. But if swelling persists more than a week, don't ignore it. Get a checkup and maybe an echocardiogram or kidney test. Still here? Comment *6 below if you've ever noticed swelling and want to spread awareness. Someone out there might catch it early because of you. Final thoughts. Now that you know these 6 silent signs your body might be sending, I want you to remember one thing: your body always speaks. The question is, are you listening? Most major illnesses start with small, almost invisible symptoms, things we often call normal or nothing serious. But by paying attention early, you can prevent complications, protect your organs, and even extend your lifespan. Here's a quick recap. Constant. Fatigue, shortness of breath unexplained. Weight changes, digestive problems, frequent dizziness, swelling. In legs or feet, if any of these signs sound familiar, don't panic. But don't ignore them either. Sometimes, just one doctor visit and a few basic tests can make a life-changing difference. And before we wrap up, let's do something positive together. Comment below which sign surprised you the most. Hit the like button if you found this video helpful. And don't forget to subscribe for more weekly health tips that keep you and your family safe. Because when you understand your body, you take control of your life, and that's the best kind of medicine there is.